discussing a little bit about blood pressure and the concerns that a cardiologist had, and he had mentioned to you maybe you can manage this naturally. So discuss with us how you've been doing.
Right. So when I started working with my doctor, and he was expressing concerns about things like heart disease and prediabetes and so forth, and there were several factors that contribute to that, among them blood pressure. We started monitoring, and then I got a cuff and began doing that myself. Mm-hmm. And so for several years I had been monitoring it, and got to the point where I was getting an average of 140 to 145 against about 80 to 90, okay. 85 to 90. Yep. I found that through diet I was able to affect that, and so I went through a kind of a self-imposed, not quite as restrictive diet as what the SP was doing, but I found that in fact I could improve it, and I did improve it to around 140 to over about 80 or
okay.
so.
Going in the right
going
direction,
into the
but
regimen.
not
right.
there yet.
That's correct.
Okay.
And then we went to this regimen, and so I decided to take it. And what I found before, and what I applied here, was I took it consistently, same time every day or
right.
multiple times a day, and understanding that when you eat, your blood pressure goes up a little bit and so forth. So trying to keep it as consistent as possible in measurement, right. so that we could believe the data.
Yes.
And what we found was that I started on the order of upper 130s over I would say lower 80s, and now through the last 3 weeks it's averaged about, I'm looking at the data, about 125 over 75 or so.
Wow, okay, so there's a significant jump from where you were on your own to using the 21-day detox program and it driving it down to what we would consider to be textbook normal. 120 over 70 is perfect for a person your height, your age, your weight, and that would be something that is consistent with a healthy person without any cardiovascular disease or without any concerns with their heart. So would you recommend this program for someone who wants to lose weight, who wants to get into shape, and possibly bring down some of those numbers like sugar and heart blood pressure?
Oh, absolutely. In fact, as we took the blood test, all of the blood work actually pulled into the normal realm, and so at least the ones we got.
Right.
And so my intent would be now to kind of keep the momentum going, to continue to begin introducing foods, continue monitoring to see how it affects my systems, and see that if I can, especially if I find something that begins to spike it back up, I know I will stay away from that, of course.
Sure.
And so it's part. I have to say I would recommend it. Mm-hmm. It requires discipline.
Yes, it does.
It requires you have to be consistent. But certainly, from a health standpoint, the benefits were worth the stuff you go through.
Absolutely. So that just wraps up what can happen with the 21-day detox program relative to some of those real important things like body fat, weight, heart health, and also sugar. Regulation. So we want to be able to make sure that this program can be used for a variety of different